I will ask Dr. Maisa Shawki to take the floor. Dr. Maisa, she is the professor in Cairo University, Faculty of Medicine, and she worked with lots of international and global organizations, from among it the United Nations, the UNICEF. She worked also as a consultant for many organizations. Please, the floor is yours. First of all, I would like to thank the Egyptian Center for Economic Studies for inviting me, giving me such an opportunity to talk with you in launching, as a start of launching a chain of conferences and meetings concerning the population problem, wishing to have prompt recommendations and solutions. I'm going to talk about the institutional framework for the population file in Egypt, at least when I was a minister for 2 years, how this file was affected, being part of the Ministry of Population, Health and Population. Where are we now? As Dr. Maged Osman talked, now the council, from the year 1985 till now, the supervision of the council was changed. Once it was under the supervision of the president, then the prime minister, then the Ministry of Health and Population. Okay. This cocktail the cocktail of regulations, or this cocktail of decisions that were taken concerning the population problem, for sure it has an effect. We cannot say that it is a positive or a negative effect until we focus on this. Actually, I wanted to tackle this point. I will say that the effects, or the first of all, we are far behind in implementing the plans and the strategy. We lose the trust among the employees. They are not any more committed. And then we don't have like a clear department that is responsible for setting the priorities. In the last session or in the previous session, we were talking about multiple donors that they give many organizations in Egypt, either as a kind of a donation or a loan, but actually we don't have a proper figure horizontally to say who is doing what, or to take a decision in a different way in order to benefit and to benefit from these resources. So first of all, we wanted to say if this Council for Population, is it effective or not, or why not we do a kind of bypass. Then being under the supervision of the Ministry of Health, and here I'm talking of the effect on the file in the period of time between 2015 till 2017, that the Council did not meet since May 2015, and this means that the Vice Minister, that they are dealing or tackling this file away from the representatives of the other ministries. And we should establish a committee from the different ministers, the Ministry of Education, Youth, Health, Higher Education and Education, because of the National Strategy for Population, we have 49 departments. Number 48 is the National Council for Population. So there are people that they got the message that they are outsiders and they are not welcome in the council. Then launching a new strategy, although we started implementing the mother strategy that was launched in the year 2015-2030, and this was launched by the Prime Minister in December, and before the report, the population report, there was a kind of process that the Ministry of Health will conduct a new strategy for population. It was like 6 months and we did not have the report of the population to say what we need to change in such a strategy. And then the actual plans, they stopped because all the stakeholders that they are dealing with us, they didn't know what is our plan, what is our precise specific plan. According to this, not implementing the plans for the governorates. There was a decision taken by the Prime Minister in order to develop and to improve the governmental plans. We improved about 25 plans and were submitted to the ministry according to this, and with the help of the High Council for Planning to conduct a kind of innovation and creation that will be more updated and to be easier to deal with. And we put in it all the scientific outcomes, all the researches and all the studies that were conducted. And after such a great effort, I would like to thank Mr. Abu Raya. After such an effort that was exerted by the support of the National Council for Planning to improve the plan, not only in 5 governorates, but in 25 governorates, it was an effort that was done, but unfortunately it did not reach reality. So how the governorate are working now? They are working with the plan of the previous year that is not updated.
As a matter of fact, this is an unwarranted delay. While we announced the population scheme in 2017 in the presence of different ministers, but based on the visits that were conducted, there was no implementing program. So while managing a ministry as big as the health ministry, the family planning aspect is not tackled adequately. Also, 5 million Egyptian pounds were reimbursed. We were asked to spend the whole 5 million before the end of the fiscal year, and as such, it was a very hefty job to go, as according to the law. The council, the population council, lost a lot of money and aid because we did not have enough time. And as such, we cannot request the same amount of money or even more. The research, the compounded population indicators were not used. Over the last year, the strategies were implemented, but the effect could not be assessed or evaluated adequately. We had one of the statisticians who gave us a tool that could be used in the implementation, and based on the quality of these indicators, we trained all the different departments of the Population Council, and we have yet to establish a database, but everything was stopped in its tracks. The population, the compounded indicators were not formulated. Also, the population observatory was discontinued. We formulated all of the indicators and the logistics and the expenses required in November. That job or this effort was also discontinued. The branches of the council, of the National Council for Population, have to be connected with the different ministries so that we can get the different statistics. But while working on this observatory, another parallel process was in place about raising the awareness of the indicators, and we had to do 12 or 11 workshops. In November 2017, when we corresponded with the different ministries, we were told that those who were trained actually quit the job. The projects that are foreign funded are still also stopped in their tracks. That project was responsible for improving the administrative aspects and to hold an international conference on population. It was supposed to have major outcomes, and that project was stopped and eliminated, and our hopes were completely dashed. Where we wanted to go, we have a vision for 2030 to have a more balanced society between the natural resources and the population growth. We're talking about a better quality of life, better living standards, and equal opportunities and access to to basic services. And to have a well-balanced society. This we can achieve if we follow the different objectives, identifying the different interventions. The national strategy for population includes 5 pillars, the 3 of which are considered to be serving family, to be closely connected to family planning, and we have the population media. Integrating men is very important, but we have to increase the demand while we have a population awareness pillar. Where we are going to be a projection based on the National Council for Population, based on Egypt census in 27. By 2013, if we have this sustained birth rates, we're going to reach 125, and if it drops slightly, we're going to the population is going to stand at 120. The recent study conducted by Basira Center pointed that we cannot reach a population growth of 2.4. Our best effort is to reach 2.7. And our best hopes is to reach the population of 120. So we lost part of our hopes because we are not dealing with our profile as seriously as should be. Basira Center additionally revisited our objectives and the indicators connecting between the sustainable economic development and the population. We have different indicators, including female empowerment, child marriage. All of these objectives and goals were thoroughly examined, and we have different milestones set within these targets. So, can we meet our objective based on our current efforts? We used to say that the government rates have good, bad, or medium objectives. In 2016, we wanted to focus our efforts on government rates with poor characteristics. We focused in 2016 on the government rates with very low characteristics. What we did was a success, but it was a very limited success. We were thinking about what we should do in order to get better to get better results. So these villages or small cities of the red colors decreased from 35 to 18. With a reduction rate of 66%. So this digital population indicator was good, and we decided to focus on the yellow areas as well, not only the red ones. We produced and distributed the media professional booklets on population, because it was noticed that the population issue was only tackled in numerically. So we have the health mother and child health manual that was targeting the literate women. We also produced 90 awareness messages, including all of the population aspects, and they are available at the National Population Council, and they are derived from the two booklets. The first comic sitcom, and also we provided convoys to the governorates that are in most need, so that they can receive the treatment. And we had 3 workshops in the Population Council. It could not be delivered on the ground because there was no serious will. There was also another limited success. We had 4 phases of raising the awareness, which was part of our objective in order to bridge this gap. We had the ambassador, the media ambassador initiative. We gave them the booklets, and we allowed them to go on to their talk shows and talk about these awareness messages. We also had another initiative in the university, starting with 1100 and ending with 6,000 students. The rural health workers also were employed. We also used the around 50 students in these convoys, and we also went to Banha and Qalyubiya. So if we manage to have the people going on these convoys well trained on the messages that are well designed to the targeted communities. We had the Muktamana Masri initiative that was designed to improve the characteristics of the slums, and we had different activities included for raising the awareness. It revolves around the same idea about integrating the concepts, regardless of the faith itself, in the religious period in school. But we saw husbands and wives in the rural areas going to workshops on how to resolve their conflict peacefully. Can the National Council for Population to do its role? No. It's a big no. It's a big no. Why? Because the Council failed to convene since May 2015, which throws into question its ability to enforce the decision. Also, the weak representation of these stakeholders. we had Dr. Maha, but the council did not convene. I singled you out. And the lack of representation of the partners actually led to a weak ability or inability to take decisions. Some of the committees that were responsible for the topics and the convention rate only reached 20%. So even if we have a strategy and then an executive plan, and the executive goes to the governor, we reach a point of lack of implementation, absence of implementation. The lack of updated databases. The National Council does not have to rely on the research it finances. It can collect information from the different stakeholders, and they can be turned by a specific or a competent agency into certain strategies. So the researchers' inability or their inability to command another foreign language, they only speak Arabic, hinders or limits their ability to collect the data. The lack of coordination between the different agencies. Mr. Ahmed said that our branches work according to the DOS, and DOS is is a system, is an operating system that ended in the 80s. And as such, there is a huge problem when it comes to communication. There is no modern system for monitoring and evaluation, but the observatory, the population observatory, once comes into existence, is going to be a huge service to all of the stakeholders. The strategy is printed out. It lacks the finance, or the finance is included but is insufficient. So people were asking that in the whole of Qalibiyya, according to the printed out strategy, that it's going to train 20 persons, it's going to provide literacy classes to 50 persons. I mean, you would panic. I mean, the more you read into these profiles, the more you would panic, because you have very low set objectives. You have no finance or no funds provided for your objectives. The limited training programs. Once I was admitted into the council, I was told that we do not have any finance. We do not have any finances allocated to the training. So we have to modernize all of these programs. The National Strategy for Population is a very good one, and While I received it, they said that it included the National Council for Combating FGMs and Cutting and Family Planning and Reproductive Health Strategy and a strategy on the elimination of early marriage. You'll find that the first one is financed by different agencies, and it includes over 20 governorates in Egypt. So this program that combats FGM should be a national program because the other experiences were very successful. I only have 2 minutes. The reproductive health strategy was not fully integrated into the population strategy, and the one on combating early marriage was not allocated any finances. The Motherhood and Childhood actually takes up half of that pyramid, so we can design these strategies, but we fail to implement them. On the right-hand side was the convention of the coordinating meetings within the council. These coordinating councils should be convened. As for the convention rate of the regional councils within the governorates, reached the rate of 29. Exactly 32 councils out of 110. The population council should convene every month and to bridge the gaps. After the cabinet decree, we had some improvement in the convention rate, and it went up to 33%, which mirrors the lack of attention that is given to this profile. We must have drastic solutions provided to solve all the problems met by the council, being the supreme national agency that is responsible for the whole profile. When it comes to education, we only address 2 points: integrating the concepts and the population concepts and issues in the school curricula, introducing a law or a ministerial decree to connect literacy with the issuance of the ID. We can actually combat illiteracy within 7 years. Expansion in establishing statistics agencies. We should go ahead with the observatory. We should also improve the technical performance. And since we have the program that is set and that's fully prepared, we can go ahead with it. We should also enforce the Population Development Atlas. Increase the National Population Council budget and include allocations for all of the items. To introduce mechanisms that would commit all of the ministries, because a ministry knows its mandate, knows its objectives, and some of them actually came to our meetings, but no work on the ground. Thank you so much.